Minister of Health Dr. Frank Anthony says Pfizer's recent announcement on Paxlovid, an antiviral drug against COVID-19, is welcoming news. The minister was speaking during Wednesday's COVID-19 update.
I think it's good. Most of the medication that we have right now to treat COVID-19 patients would be infusions, things that you have to inject, and some people would prefer to use tablets. So this is a good development, and as we know, right now the studies are continuing. Yesterday, Pfizer would have released the data that you're quoting, and that is they did a study with 2,246 persons, and they found that the efficacy of the tablets to prevent hospitalization and deaths was about 89%, which is really good. What it also shows in this particular study is that for patients using Paxlovid, they had a lower viral load. And if your viral load is quite low, then it prevents transmission of the disease. So that's a good development as well. So Paxlovid is yet to be approved by the US FDA, but certainly once it becomes approved by the US FDA, other countries would be looking to secure and to get these tablets as part of their arsenal against COVID-19.
Minister Anthony says, as it pertains to vaccines, the government has not signaled any intention to begin manufacturing these.
Vaccine manufacturing is a very complicated exercise and a very expensive one. And therefore, at this point in time, as I've said before, the government is not going to be going into manufacturing of vaccines. More so if you have additional capacity being built around the world, we would be able to access vaccines quite easily and relatively cheaply once that capacity is built out around the world. With the COVID pandemic, what was very clear is that there are gaps around the world in terms of vaccine manufacturing capacity. So we have seen that in Africa, we've seen that here in the Americas, and therefore many countries are taking steps to address these gaps. So here in the Americas, we have, for example, Mexico has been working on developing its own vaccine manufacturing capacity. We have had similar developments in Argentina, in Brazil, and in Chile. So the region in the next couple of months would have enough capacity to be able to produce all the major vaccines that are being used against COVID. And so that availability then of vaccines would become much more easier. Now for adults, first dose, we are at 407,341 doses. That's about 79.4% of our adult population. And for second dose, we are 288,315, which is approximately 56.2% of our adult population. For the 12 to 17, we are now at 29,865. That's approximately 40.9% of that age cohort. And for second dose, we are 21,107 persons, or 28.9% of that age cohort. Booster doses are going up incrementally, so it's right now we're at 7,270.
On monitoring, Minister Anthony says the National COVID-19 Task Force will continue to carry out routine visits to ensure businesses are complying with the gazetted measures.
On a weekly basis, the task force would go out to do inspections of businesses, and over the last month, they would have written to more than 60 businesses And in some instances, they shut them down temporarily because of repeated breaches of COVID guidelines. The task force will continue to do this during this season. And if persons are not compliant or if persons are repeat offenders, then certainly the task force will take the requisite action as it has been doing before. So this is an ongoing process and it continues in the month of December.
With the Christmas season fully underway, persons are also being reminded to continue to adhere to COVID-19 preventative measures to ensure their own protection. This has been DPI's COVID-19 update. For more information, visit health.gov.gy, dpi.gov.gy, and our social media platforms.